Good morning, everyone. Thanks very much for joining us today for our webinar. Giving everybody a minute to come in. So our webinar, as you know, we'll be speaking on using data to guide decision-making during COVID-19, and we're really excited to be able to focus on the experience of Peru's Ministry of Education, from which I think we can all learn a ton. My name is Bethany Park. I'm the Associate Director of Policy at IPA, and I will be hosting and moderating today's discussion. So a couple of housekeeping things as we're getting started. I wanted to let everybody know that there will be a Q&A at the end of all of the presentations, but actually anytime during our discussion today, you can use the Q&A feature on your Zoom screen. It should be at the bottom of your Zoom window. And you can just send your questions through at any time, and we will answer as many of those questions as we can at the end. Second, just so you know, this webinar will be recorded and it'll be available after our session. So that means we'll be able to share it with colleagues who are not able to join with us today live. Okay, great. So let's go ahead and get started. Okay, so we are really excited to welcome 4 guests today. First, we have Ani Chumpitas, who is the Head of Monitoring and Strategic Evaluation at the Ministry of Education in Peru. Next is Ciro Avitabile, who is the Senior Economist for Bolivia, Chile, Ecuador, and Peru for the World Bank. Welcome, Ciro. And finally, 2 of our own from IPA, Juan Manuel Hernandez Agramonte and Sergio De Marco, who are the leadership team for IPA's office that covers Peru, Bolivia, and Paraguay. So thank you all very much for joining. We're very excited that you are here. So before we dive into the details of these really exciting studies and the really exciting research, I'm going to zoom out super briefly to help us sort of motivate this and explain the vision for why IPA is doing this kind of work and our approach for ensuring that rigorous research is used to improve lives. Okay, so huge zoom out. IPA's vision is a world with more evidence and less poverty. We're committed to using rigorous research to reduce poverty and to improve lives. So as everybody here is very aware, global extreme poverty is an urgent problem, and the global community spends billions of dollars each year to try and solve this problem. Unfortunately, a lot of that money is spent based on the best guesses of people who control it, rather than on rigorous evidence on what actually works. And so IPA, simply put, exists to help solve this problem. We do rigorous research to figure out what actually works, and then we work with a wide set of partners to make sure that that evidence is used to improve the way development money is spent. We are pioneers in figuring out how to solve this enduring problem by leveraging research. So earlier this year, as you very likely heard, 3 researchers whose work was very foundational to our approach won the Nobel Prize in Economics. But although IPA is known for RCTs, that is not all that we do. We've learned over the years that just conducting RCTs is usually not enough to get evidence to the place where it is able to be leveraged to improve lives. So our work is really focused around 3 pillars these days. So in the first pillar, we are co-creating evidence with partners whose buy-in is necessary to get evidence actually used. In the second pillar, we are sharing evidence strategically, as we're doing today at the global level, and more often as we do with our local partners through our country offices. And third, we equip decision makers to use evidence. This is IPA at a glance to show you some scope. So we work widely across program areas. We've conducted 850 evaluations to date. These are primarily done through our 22 country offices around the world, where we have a long-term local presence, but we've also worked in a set of other countries. And we do none of this alone. We work in close partnership with hundreds of the best researchers from around the world. And we also work closely with partners who are actually designing and delivering programs. And none of this work would be possible without these deep partnerships, as I think today's conversation will definitely illustrate. Okay, so in response to the COVID-19 challenge, IPA has been coordinating our RECOVR initiative, Research for Effective COVID-19 Responses. This initiative has many parts, and I won't go through it all, but the three that are on your screen are some of them. So we've been conducting rapid response surveys to answer key policy questions. These are surveys we construct with our policy partners and deploy in a timely manner to get them the information they need for decision making. Very closely linked to that is that we've been advising and partnering with governments on evidence-based approaches to meet these challenges. And then the final one that I would actually encourage you to check out is that we've been curating a global hub that centralizes research and policy lessons. So if you're interested in not just what IPA is doing, but what many other partners are doing to try to inform a data-informed and evidence-informed response to the COVID-19 challenge, I would really encourage you to check out the RECOVR Hub, which is linked on the IPA website. All right, so now to introduce the webinar. You can see our motivating questions on this slide, and we know that these and other questions have been on the forefront of decision makers' minds while they're formulating policy responses to the COVID-19 pandemic in Peru, which unfortunately has experienced some case spikes in recent weeks. In the education space, there is global concern that these challenges are going to really affect learning, particularly for vulnerable students, particularly those in remote areas, those who are very young learners, and everybody is very worried about the effect of school lockdowns on those students. So IPA and the Ministry of Education in Peru, who's been our very close partner for many years, have been working together throughout this crisis alongside other partners to co-create rapid data and evidence tools to assess a variety of education solutions and to identify the most effective of those solutions to support children's learning and development in the current context. So this webinar brings together 4 aspects of the ministry's approach to using data to guide its decision-making during the pandemic and subsequent recovery. So first we'll have Ani Chumpitas from the Peru Ministry of Education, who will discuss how the ministry is using data to monitor teachers and parents' interaction with remote learning through an interactive online dashboard. And then Juan will come in to highlight how IPA and the Ministry of Education are working on a distance assessment that can be administered remotely to understand the learning levels of preschool children. Finally, or next we'll hear from Jiro, who is going to present a project that leverages machine learning techniques to anticipate the bottlenecks in distribution of tablets, which the ministry is trying to distribute to those who are very remote and who need those tablets in order to access distance learning. And then finally, Sergio de Marco will share details of a project using existing evidence from Liberia and from Peru to shape a national information campaign on returns to education. The motivation behind this is to prevent COVID-19 related dropouts, which is becoming a concern. And then, as I've mentioned, we will follow the presentations with a discussion and Q&A. So with that, I will hand it over to Ani.
Thanks, Bethany. Hi, everyone. I'm very happy to be able to share with you the experience of the Ministry of Education of Peru regarding our tool for remote monitoring. I'm going to share my screen now. Can you see my screen?
Yes.
Great, thank you. So, a quick brief overview on what the ministry and the Office of Strategic Monitoring and Evaluation are. So the ministry is the public entity that sets the educational policies at the national level, and to implement these policies across the country, we work very closely with the regional departments of education and the local management units. and we have 26 regional departments of education and over 200 local management units. And even though the ministry has a long history, office is relatively young, relatively new. It was created back in 2015 in the context of educational reforms. And we were seeking in that moment to promote evidence-based educational policies. And in that sense, our office had a key role, still has a key role. So basically, what we do is we coordinate the generation and analysis of statistical information and evidence regarding the performance and impact of education policy interventions. And to do that, we have different M&E tools, and one of them is the one we're going to discuss now. So this year, classes were scheduled to begin on March 16th, and due to the pandemic situation, our president declared in that same day the state of emergency. So at the very beginning, we postponed the beginning of classes to March 30th. However, the cases of COVID just increased and increased in that moment, so the lockdown and the emergency situation was extended, as well as the beginning of the classes. In this context, the ministry, as Bethany has already explained, we decided to launch Aprenda en Casa, or Learning at Home. And Aprenda en Casa is basically a multi-pronged strategy for students in preschool, primary, secondary school, and in special and alternative education, so that these students can continue learning from their homes. Due to the heterogeneity, the diversity of our country, we had different allies from public and private sector, so that we are able to launch this strategy on TV, radio, and websites. As a ministry, we didn't have prior experience with this application, and the main virtual platform we had in that moment was known as Peru, which was basically aimed to provide information to the teachers, but not directly to the students. So this was a real challenge for us, and the different departments of the ministry had to work very closely and fast, very fast, so that we were able to launch this strategy on April 6, 2020. So as you can see, in like a couple of weeks, we were able to put this available for the educational community. And of course, to make sure that we are implementing correctly the best we can this strategy, Aprenda en Casa, the ministry required information on how this educational service was being provided. So to do that, we ran a monitoring tool based on remote collection of information with telephone service. And these telephone service were directed to principals, teachers, and families, so that we can collect information on key aspects. Basically, access how their experience was with Aprenda en Casa. And we do this telephone service all across the country, covering the 26 regions. And since the very beginning, April until today, we are doing this telephone service. And to make sure that we have the best evidence we can in the context, to make sure we keep the quality of our information for decision making, we have set specific protocols and standards, such as identifying which are our main objectives that we want to reach with the survey, which indicators we want to collect and to provide to the ministry and to the regional departments of education, as well as to the public. So we prepare these questionnaires with this in mind. We determine the sample design, we pilot the questionnaire and review these. We set all the methodological protocols and documents, and we make sure that our enumerators, they have certain protocols, they know how to reach the families. which, by the way, was the first time we were reaching the families directly. In a regular year, we would just place a visit, random visit to the school, and interview only teachers, principals. But this was our first time reaching the families. So we wanted to make sure that we have all the protocols, the people calling know exactly what to say and how to talk to the families and to the principals and teachers. So we make sure we have certain protocols in analyzing the data, processing, and generating the reports, and also communicate the results. We also wanted to make sure that the families, in general, the respondents, feel safe and secure when receiving a call saying that it's from the Ministry of Education. And that's why in the same website of Aprendo en Casa, we have a link in which you can introduce the phone number from where you are receiving the call, and you can see if that phone number is registered in our database and if this person is allowed to call you in the name of the Ministry of Education. So I'm going to try to see if I can share with you the website. It's loading. So this is the website, and here you can see our results. So far we have April, May, and June. We are still collecting information from families July. In this space we can see if the information is from the families, the teachers, the principals. Still loading. I guess maybe a minute. Okay. For instance, if we go to families, we can check the coverage of the calls. We basically call almost 100% of the sample. In this case, around 60% of the families responded. We have information on their connectivity means, the access. We can see that the most used mean is the television, that around 90% of the families know Aprendo en Casa, and 95% of these families have access to Aprendo en Casa.
Excuse me, I think you share your browser because we are seeing your PowerPoint.
Oh, sorry. So maybe so that we can continue. So this is basically, do you see now my PowerPoint, right?
Right, we are seeing your PowerPoint.
Okay, so I had certain issues in sharing the other screen, but basically these are the different screens that you can see when you have access to the website that we can share with you later on. And in the different screens, we can check the coverage of the calls. Like here, this is the information related to teachers, like 98.5% of the teachers that were included in the sample have been contacted. And related to information related to the satisfaction of the families, we have that 55% of the families are actually satisfied with the content. And however, like 82%, 83% of these families believe that Aprendo en Casa needs to continue even when we go back to schools. And information also related to the teachers and coordinators in rural areas regarding if they are keeping in touch with the principals and if they are being in touch also with the families. So there's a lot of information that we can collect with this phone service. And this information, we've been collecting it since April, so we can keep track on all these indicators. Give that to the different departments of education in charge of the implementation of the policies. Okay. So to wrap up, we have used this information and we are using it, first of all, to keep track or to know how we are progressing in implementation of Aprende en Casa, to identify the limitations in accessing the strategy. Let's say in certain regions, the access to certain platforms of Aprende en Casa are being more difficult, so that we can coordinate as a ministry with different public or private allies, different sectors, to improve this access, and so to make sure that the students are still learning even though from their homes. We provide feedback for continuous improvement of the strategy, and we motivate also including in our educational policy different interventions, like parental support for preschool students that we have identified as a very important intervention. Also interactive radio to reach to the most rural areas, also to students with different language than Spanish, and in general to inform the guidance that we provide to the key educational actors in the ministry and in the regional and local management units. And we have seen that this tool is a very rapid way to collect information, to collect strong evidence, and to inform our different policy decisions. So over these months, we have also learned different things, and we're adjusting the way we run these tests, this service. We have also used the service to other purposes related to the educational service, like we've been able to estimate the potential demand for public schools for students that were at the beginning in private education. We also use it to estimate the potential demand for face-to-face caregiving in preschool students. And one thing that we want to stress is that because of these phone calls, we've been able to collect information from areas that previously were more difficult to reach in person because of the cost or because it was very difficult to access. So we have learned many things from this rapid service, and even though this is a very new tool in our office and in the ministry, we strongly believe that it's being very useful and that it's a way that we can use now, and as long as this state of emergency and the pandemic continues, we're going to rely on this information. Thank you very much.
Thank you, Annie. So I will share my screen now. Hi, good morning, everyone. Thanks for your interest in this seminar. I'll be presenting a work that I'm doing together with my colleague, Olga Namen, who is a postdoc at IPA, and Emma Naslund, who is a lead education specialist from the IDB. The project is called Distance Learning Assessment for Impact Evaluation During Lockdown. So there are three main takeaways in my presentation. The first one is that we find qualitative evidence about the feasibility of doing distance learning assessment during lockdown that can be used for impact evaluation. The second one is that the mode that we use for the distance learning assessment, it restricts the domain of knowledge that can be measured. And the third one is that parents play an important role on the implementation of these assessments. So under lockdown, there's a new set of needs and new actors that need to be integrated into educational policy. Ministers of education across the globe are launching distance learning programs without previous experience of how to do it. Also, parents and caregivers are taking the lead on the education of the children at the household level with high heterogeneity in terms of knowledge, skills, and and resources that could impact their productivity. So in this setting, we need policy innovation more than ever. So government needs to test and adapt in the fly. One important tool for innovation are impact evaluations. We can design and implement policy pilots and use evaluations to identify whether they work or doesn't work, and based on that, make decisions to scale it or adapt. The Ministry of Education is preparing several policy pilots that need to be tested, and one of the main ingredients for policy evaluation is having information on the outcomes. And in the current context, in-person assessment for measuring education outcomes are no longer viable. So the question that our project wants to answer is, how can we measure education outcomes during lockdown to design and identify policies that are effective? One way to do it is using distance learning assessment as opposed as in-person assessment. This has been done, for example, using phone-based assessments, which has shown successful to measure cognitive skills of young students from 6 to 8 years old. And there's a team of researchers that are currently doing distant assessment tools for primary education in Botswana during lockdown. Another way to do it is using digital technologies, but we know less about how to do this in a good way. One of the most recent work has been done by Hodge and other researchers that use web-based literacy assessment for children between 8 and 12 years old. Our project aims to fill some gaps in this literature. First, we want to develop a distance learning assessment that is useful for impact evaluation and is suitable for the Latin American context. We will be targeting children between 4 to 6 years old, which is going to be the first time that an assessment targets this age population. We will be using audio and video call-based assessment. This means that we could use audio for household that doesn't have internet connection, and we could use video call for household that have internet connection. And this is the first time that video call assessment are going to be used as well. And we will be combining information coming from the children and caregivers to have a more holistic perspective on the skills of the children. So as I was mentioning, we will use video assessment. That means that we need households that are going to use this mode to have internet. And in Peru, it's important to take in account that 89% of the population that has internet access, they access to it through their smartphone. So any content that you want to display to this for this assessment has to be suitable for a smartphone screen. We will be using then audio and 2 types of video calls. So one that we call unilateral video and the other one that is called bilateral video. In the unilateral video, neither the numerator or the student can see each other, but the numerator can share the screen with the student in order to display images and content. In the bilateral video type of assessment, both the numerator and the student can see each other. This is an option that we gave to households in order for them to decide what they feel more comfortable with, and in that way to take care of their privacy. So the main difference of these modes is first on the visual stimuli that you can use to test. So in the case of audio, you cannot use visual stimuli for making the test, but you could use potentially text messages. Nevertheless, because of the age range that we are trying to test, this will be difficult. So we are not using text messages in this case. And for the unilateral video and bilateral video, as I already mentioned, you can share a screen and share images with the student. There's another difference between the unilateral and bilateral video. The main one is that you can capture nonverbal responses using the bilateral video. In this image, you can see an example of a bilateral video assessment in which the numerator is able to capture a nonverbal response from a student. In order to develop this assessment, we're going to follow the usual assessment development strategy in which we will be taking care of the psychometric validation, procedures and logistics, ethical considerations, and cost effectiveness dimension. But in addition, we are interested in understanding whether using these different modes will have an effect on the performance of the instrument. In order to do so, we will be randomly allocating households with internet to two types of measurements, the video and the audio assessment. For all these studies, we will be combining quantitative and qualitative methodologies. One of the first stages of the assessment development is what we call the pre-pilot or the feasibility study. In the beginning, we were concerned to what extent we could use phone-based assessment and video call assessment in order to measure learning. And so we did this small pilot with 18 households in different areas of Peru in order to understand if this was feasible. And we came up with three main findings, which I'm going to present right now. The first one is that the mode that you use for the assessment imposes restrictions on the domains of knowledge and items that you can use for the test. We were using the MELCO instrument, that is an instrument that is used by the Ministry of Education for this age range, and it consists of 23 different tasks. In the translation process, we were able to translate 10 tasks for the audio mode and 14 tasks for the video mode. And there were two main limitations that that oblige us to have this limited number of tasks translated. So the first one is that items with visual stimuli, such as naming numbers, cannot be translated into the audio version, as I was mentioning before. The second one is that not all nonverbal answers can be captured by the video. For example, items such as asking the kid to jump in one leg in order to measure motor development might not be able to be done, to be captured in the image that you get from the call. The second lesson is that parents play a very important role during the assessment. Usually when we do tests to these ages, we visit the school and we test the children in their environment, and we rely on the principal and the teacher to take care of the logistics and to audit the test. But in this case, we are accessing to the household and we need to coordinate with the parents in order to implement the test. So parents are expected to provide the informed consent. They receive instruction of how the application should be done, and they facilitate the application with their kids. They have to monitor the application. We want parents to be there in order to safeguard the children. They also need to fill their own test. And finally, there's an important work to be done with parents in order to mitigate their intervention during the test. We need to tell them that these are low-stake tests, that there's nothing important that you will get out of this test in terms of incentives, but the information that we will get will allow us to improve policy, and therefore their kids will be benefited. The last lesson is that both modes show to be able to capture students' skills. Both of the modes have adequate average length. The audio assessment has 21 minutes length in average, and the video 24. Both children understood and answered most of the questions, and parents and children provided positive feedback. For example, one parent said that Jorge, the student, was very comfortable and happy during the assessment. It was like a game for him. This is very important because there was a concern that testing during lockdown could increase the stress level of families, both parents and children, and we've seen that this is not the case. So an overall learning is the trade-off between the in-person and the distance assessments. So distance assessments have many benefits. For example, they can be applied during lockdown, as we have discussed, but also they could help us to reach out to areas that are difficult to access. They also have a lower cost, so potentially are cost effective, and they allow us to obtain information on the caregivers and the children. Whether, for example, when you do in-person tests at the school level, not always the caregivers are present during the test, so you may miss the information on the caregiver. Finally, because you record all the audios of the test, you can use these audios with new analytical tools such as neural networks and machine learning in order to study some outcomes such as depression levels and so on. There's also drawbacks to the distance assessment. For example, It depends on the connectivity of the household. So you may have restricted representativeness if the household doesn't have internet or phone connections. You have a reduced attention span from the children that goes from 15 to 20 minutes. And this imposes a restriction on the number of domains that you can measure in one call. In addition, as we already saw, the modes have also restrictions on what domains can be measured. And finally, there are challenges to quality measurement that were not present on other type of assessments, such, for example, the quality of the connectivity and the parent intervention. So the next step for the project will be to continue the iterative piloting process with larger sample sizes. And once we have a robust instrument, start the mode experiment project. We will also use one of these modes for impact evaluation to evaluate two different interventions that we are implementing with the Ministry of Education, one on interactive radio instruction, the other one on social emotional and distance learning parent support of text message campaign. And finally, we would like to explore the use of this type of assessment for targeting. You can identify subgroups that are falling behind and derive resources to them. And also you could potentially complement in-person tests with this type of distance assessment, providing you with high frequency data. Thank you very much. And I think I will give the mic now to Chiro.
Thanks a lot, Juan. Thanks to everyone for attending this seminar. What I'm gonna present is work that we are starting now with the World Bank in the Lima country office, and with the IPA we are working closely to support the ministry in the Aprendo in Casa strategy. Just a second, I can take. Oh, I think I already jumped to the end of the presentation. Let me start. Okay, so I'm going to talk about work that we are starting with the IPA office in Lima and in supporting the Ministry of Education in the Aprendo en Casa, and we are focusing on a particular strategy of Aprendo en Casa, that is a delivery of tablets. Annie provided a pretty careful description of the background, and I will not repeat what she already mentioned, but one important measure that was taken during the lockdown and the rollout of Aprendo en Casa was the announcement of the purchase and distribution of tablets to reach the most vulnerable children in Peru, those basically with no access to digital device. And exactly for the focus of these tablets distribution, this is a very complex delivery because the program aims to distribute more than 1 million tablets in 25,000 public schools, covering all grades from 4th grade in primary education to the end of secondary. 85% of the targeted schools are located in local area, and a significant share of these schools have no internet connectivity, and to a lesser extent, no electricity connection. Since the beginning, the ministry aimed for an end-to-end delivery. So in order to avoid that the tablets would spend a lot of time, like in warehouses somewhere in Lima or in other main urban areas, they opted for an end-to-end delivery, with the private providers in charge of delivering the tablets to the schools already ready to use. The initial budget for this is 650 million soles. That is about 10% of the 2019 Ministry of Education budget. So you can understand that this is a massive program, distribution program. And what are the main challenges? And clearly, here you see only some of them. It is not a comprehensive list of the issues that ministries usually encounter when distributing tablets. So the first is, supplier selection and supplier relationship management. You need to sign contracts. Given the number of tablets, you need to sign contracts with the many different providers that do not necessarily have the same logistics capacity, and they will often face different conditions for the delivery, depending on where the school is based. And the product that they are going to deliver has often very heterogeneous characteristics. So the contents, both in terms of hardware and software of the tablets, will change depending on the level of connectivity and the education level. So just to give you an example, if a school has no electric power, the students of the school will receive the tablet and the solar charger. And perhaps one of the main challenges is the planning of the Minedu workforce, because the ability to monitor quality standards will vary again according to the geographic location and also to competing needs. And last but not least, there is a potential high cost of maintenance. So, for instance, we know from the Plan Ceibal that during the first year of the distribution of their tablets program, about 90% of the tablets needed to be refurbished or have some type of maintenance. And clearly, in a country that has, Peru, that has a very complicated geography, this might be extremely expensive, both in terms of money and time. But just to give you an idea of why uncertainty can potentially complicate the relationship with a tablet provider. So when you sign a contract, often important details are unknown. For instance, something very basic, the exact distance to the school. So together with the IPA, now we are looking at the characteristics of the 25,000 schools that are part of the target group. And we see that about 5,600 have no information that allows, we don't have information to calculate the exact driving distance to those schools. And clearly, those 6,000 schools are not a random sample. And in fact, as you can see on the right side, when we compute the Euclidean distance of those schools for which we couldn't calculate the driving distance, you see that for about 25% of the schools, there is a distance that is about 30 kilometers, and for 10%, the distance is 60 or more kilometers. So how can machine learning help in this case? Machine learning makes it possible to discover consistent patterns in historical data about program delivery by relying on algorithms. And in this specific case, the empirical exercise can help Minedu to at least with the four objectives. First, to reduce the ex-ante uncertainty when preparing contracts with the multiple providers. Second, better plan workforce deployment. Third, extend the life of the devices. possibly by optimizing the in-house and third-party maintenance. So whether sending back the tablets to the factory, or having like a small IT office that can take care of most of the issues. And fourth, but this is not something that we have currently planned with the Minedu, is doing the optimization of the logistics route. Why we say so? Just to give you an idea of what we want to do with this predictive analysis, so we want to exploit a large amount of information to basically analyze patterns and identify solutions that are group specific. And without going too much into detail with what the machine learning methods, there are at least three main categories of machine learning techniques. One is unsupervised learning, that this is the one we will use for this particular exercise. And the main objective is trying to cluster schools in a way that we have a pretty homogeneous groups of schools in terms of characteristics that for which we can provide some tailored solution. Other techniques that are not relevant in this case are supervised learning and reinforcement learning. So just and try to give you an idea of the objective of the study that we recently started and we plan to complete over the next few weeks, is that we will use unsupervised machine learning techniques on school level data in order to cluster targeted schools into homogeneous groups. So this will be basically a four-step process. We will identify relevant programs with reliable administrative data on the performance of the program delivery. And the example is the very well-known one laptop per child that Peru launched in 2009, as well as a program for the distribution of school materials. That this is something that the ministry does on a regular basis. And step, we will identify relevant contextual information for each school, for instance, the distance to the district capital, internet coverage. And with this information in hand, clearly what we will do, we will pre-select the characteristics that can be linked to clear policy actions. We will classify schools using different strategies of unsupervised learning, such as K-means or K-medians. And finally, with the taxonomy in hand, we will produce cluster-specific recommendations. So just to give you an idea of what we are getting, we have now merged the initial universe of targeted schools with information from other delivery programs and with the geographic characteristics. And one thing that we learn that, for instance, for those schools that are in the current tablet distribution universe, and we're also in the one laptop per child distribution, there was a great variation in the execution of the one laptop per child. So one of the objectives of a one laptop per child was that every child and student would have a laptop. But as you can see from the graph on the left side panel, about 25% of the schools that were part of the one laptop per child target group did not receive a single laptop during the first year of distribution, but sorry, 10% did not receive a single laptop, but it was a 10% of schools where the ratio between the number of laptops and the number of students and teachers was equal to 2 or above. So that gives us an idea that in many cases we were really far from this target of 1 laptop per child and teacher. And the situation did not get better 5 years after the first distribution. So to some extent, we interpret this as evidence that you want to get your targeting right in the beginning. You want to make sure that the program is executed in an effective way. Also because apparently you don't really manage to improve over time the execution. So the first years are really crucial. On the right hand side, at least looking at my screen, you have information about the driving duration from the school to the district capital. And again, the main takeaway here is that except for a few regions where we see that the driving distance is homogeneous, there is a lot of heterogeneity in terms of driving distance. So in some cases, schools are only 1 to 10 minutes from the capital, and in the same region, schools can be up to 3 hours or more from the district capital. This is going to really have an impact on how you shape the logistics of the distribution. So over the next couple of weeks, we hope to come up with, using all this information, to come up with a clear taxonomy that can be used to support the ministry in making this progress as delivery as possible. Thanks a lot. To Sergio now.
Yes. Okay, I hope that you can all see my screen now. Good morning, everyone. Thanks, Chiro. Thanks a lot for the attendance of this webinar. So I will be concluding this first session's webinar by giving you a bit more an overview of what we can learn from international experiences, countries that have experienced similar crisis as the one we are experiencing now in Peru, well, all over the world, and how we can use rigorous evidence to provide quick response to specific needs. The World Bank a 1 month ago or more released an interesting work in which they simulate the potential loss of due to 5 months school closure. And actually they simulate different scenarios and different lengths of school closure. But for the sake of this presentation, I will just present one of the intermediate results in which they consider 5 months of school closure. Due to COVID-19, this estimate will result in a loss of 0.6 years of schooling. That in turn, it corresponds to an earning loss of $16,000 over the student lifetime. So this is, of course, an alarming number. But even worse, this is not even the most pessimistic scenario, because we should consider what happened. There is still the risk for students that will not get back to school when they reopen. So the loss of earning and learning can be even much higher. So if we look closely, if we look at the Ebola crisis that particularly hit the West African countries, we can find some similarities with the current crisis of the outbreak consequences that can be produced over time. the effect of the current crisis and the Ebola crisis are felt not only on people's health, but also on economic and education indicators. Likely, and I mean, fortunately, we had a couple of works that collect data during the post-Ebola crisis on student education, and in particular, what happened with student enrollment right after the Ebola crisis. Those two works are one provided by the World Bank and another by a paper by Bandiera and other co-authors. Basically, those two works can help us to understand how education was affected by the outbreaks. School closure, of course, can have permanent negative impact on future lives of the student, forcing them to transition to works or chores activity, let's say earlier or more quickly than they would have chosen to without being in a pandemic or experience a pandemic. If we look at the results of the World Bank study, they conducted a frequency phone survey in Liberia and Sierra Leone, and the results showed that respectively for those two countries, 25% and 30% of the student didn't return to school after reopening. And the main reason, the primary reason for this was an economic reason due to the inability to pay school fees, but also for the need to generate income. Similarly, if we look at the Bandieras and co-authors paper, at the time of the Ebola, they had measuring the impact of a girls' empowerment programs. And when the Ebola hit, they decided to collect more data on girls' education and girls' enrollment. And they found that girls suffer the shock, the greater shock in their enrollment. And if you look at the data, 50% less like to be in school after the Ebola crisis. And also here, there was like many reasons why that was the case, but one of them is the economic reason. So one of the questions that we should be asking is, out of the 8 million students that are out of the school now, how many of them will remain out of the school once the school is going to reopen next year? We know that, of course, I mean, Annie did a very comprehensive explanation of the Aprende en Casa strategies that basically is a government investment in human capital by providing access and quality to education through the use of internet, TV, and radio. However, the access to this platform and to the Aprende en Casa is not going to be the same for all students. So definitely there are going to be students that will be benefit more than others. And we will have also that students and family will have a different level of engagement into the educational system. Also, social distancing had increased caring responsibility and the need for generating income. And then actually can have a detrimental effect on and can prevent some of the students to get back to school when they reopen. So we learn from previous experience. We know about the Ebola experiences. We know that the Ministry of Education is working now to try to understand how to mitigate the impact and negative impact of this crisis. So the idea is now to think about what we can do. I mean, what action we can take. Well, there is a consistent evidence that providing information about returns to education can be effective to reduce students dropout. And this is an evidence provided in the different settings and countries in Africa and Latin America. And all of the study show that providing information about returns to education can be a cost-effective way to reduce student dropout. But more importantly, We also have rigorous evidence, locally rigorous evidence. So a study that was implemented here in Peru and that was evaluated that show how providing information to students and parents actually reduce student dropout. In 2015, a team of researchers together with IPA, JPAL, and in partnership with the Ministry of Education, used a rigorous design, a randomized design to test the effectiveness of an information campaign to reduce student dropout. The name of this intervention is Choosing a Better Future. And the intervention consisted of providing information about returns to education and opportunity for financing post-secondary education through a well-designed telenovela or soap opera that was projected at the school level or across all countries in both urban and rural area. Sorry, I don't know if I have, okay. Sorry, in both urban and rural area. The idea of providing this information, the underlying assumption is that students and parents underestimate their economic returns of education. So by providing information, what we're doing is to try to update their beliefs about the returns on education. The results, the preliminary results of this study showed very encouraging results in reducing dropout rates. We observed like a negative effect of 1 year and 2 year dropout in both urban and rural areas. Also we've verified that providing this information actually corrected parents, adjusted parents and student perception about the returns to education. Encouraging results in the fact that providing this information and videos was a really cost-effective way to try to reduce the dropout. The Ministry of Education a year later decided to scale up and expand this program to additional 2,000 schools, secondary school with more advanced infrastructure. Those schools are the one called the Jornada Escolar Completa. So there are schools that basically full-hour schools. The intervention, the program Choosing a Better Future was part of the curricula in the tutoring hours. So we know that the program was effective. We know that the Ministry of Education already scaled up to some of the schools. So what about trying to think about this intervention also for this specific case? So we know that this crisis and the outbreak can have a detrimental effect on the students, and there is a high risk that students will drop out school next year when the school reopen. We can think about, learn based on what we learned from this project, the fact that it was effective, to try to use this intervention also now. So the IPA, together with the World Bank, updated the information provided to the students, so updated information about returns of education and scholarship opportunity, and together with the Ministry of Education, they decided to introduce this program as part of the Aprendo en Casa strategy, with the goal to reach as many families as possible. So this video will be broadcasted on national TV in the next few weeks, months. This is something that we're still coordinating with the ministry. The video will be broadcasted in session in different grades. We are aimed to work mainly in grade from the 5th of primary school to the 5th of secondary school, in which we can observe higher rate of dropout. And of course, this is a great opportunity and a cost-effective way to try to take a first step to mitigate a negative impact of the outbreak in terms of students dropout. One interesting aspect here is not only the fact that we are using evidence, rigorous evidence to take a quick response, but we also have the capacity, thanks to the data, unbeing data generated by the Ministry of Education, to measure the impact of choosing a better future when this program will be basically spread and broadcast through national TV. For this specific case, we'll be using an encouragement design methodology in which we will basically send messages and the phone call, send messages to parents and call them to provide information about the day in which the video will be broadcasted, and give and provide a bit more of information about the content of the videos. So what we're trying to do is to incentivize and promote the, of course, increase the probability for parents and students to watch the videos. Now, why it is important to evaluate the programs? It is important because, of course, when we evaluated the program, it was in a much more controlled environment in which video were projected by head teachers and teachers to a group of students in a classroom. In this case, of course, the channel, the delivery, the way in which we are delivering the video is through national TV. So, of course, the channel mechanism is a bit different, and we would need to, it would be great to understand better if the TV may be a way to provide this information, an effective way to provide this information. So what are the conclusions? We can consider like three main takeaways from this presentation. So the first one is to highlight the importance of collecting data. In a previous experience or crisis such as the case of Ebola, in which researchers and have collected data about student education and the consequences of how this outbreak in Africa and West Africa affected the student enrollment. So of course, you know, only considering or only react on existing data might be difficult. So having experience from international context can be really helpful to foresee what might be the challenges that we might expect. And as I said, there are like many similarities between the Ebola crisis and the COVID-19 crisis. So responses can be guided by lessons from international contexts. The second takeaway is that we can exploit the evidence generated not only at international level, but also, and most important, at the local level, to be a guide to respond to a crisis. So in this case, we already know that there was a program, Choosing for a Better Future, that was evaluated, and it can be useful in a situation like this, even if it's, of course, a completely different context, but it can be a cost-effective way to reduce student dropout. And the third point that is really important is how important are the administrative data. Because in this case, we will be able to generate evidence on the new implementation of the programs through national TV, and we will be able to measure the impact using admin data from the Ministry of Education on student enrollment next year. And we do think that, of course, producing admin data can be particularly useful also to understand and try to bring evidence to the action that the ministry in this case is going to put in place to improve or to at least keep student learning and reduce the possibility of students to go out and keep out from the school system. Thank you.
Thanks so much, Sergio. I am so sorry that we have gone this far over, but thank you everyone for your wonderful presentations. Sergio, I was going to cut you off, and then I realized that your conclusions are actually a wonderful way for us to sort of wrap up and conclude. So thank you everyone for your attendance and for your contributions. If you'd like to follow up with any of us, please feel free to reach out and do so. And you will be receiving a recording of this session that will also be available online. So thanks everyone, and enjoy the rest of your day.